I'd like to take a few minutes to talk with you about NirmatrelvirRitonavir, or Paxlovid. We all recognize that COVID-19 is part of the current landscape and will continue to be so. With the strong scientific evidence that antivirals reduce the risk of hospitalization and death, Paxlovid continues to be one of our most important and effective tools to combat severe COVID-19 outcomes. CDC recently published a study in the MMWR highlighting the important role Paxlovid plays in preventing COVID-19 hospitalizations. This study found that eligible adults who were prescribed Paxlovid for mild to moderate COVID-19 were half as likely to be hospitalized. This was true overall for both vaccinated and unvaccinated adults. Because people at risk of severe COVID-19, including older adults and adults with underlying medical conditions, are more likely to become very sick and be hospitalized with COVID-19, CDC encourages healthcare providers to consider Paxlovid as a treatment option for those patients, regardless of vaccination status or history of prior infection. The NIH COVID-19 Treatment Guidelines Panel recommends non-hospitalized adults and pediatric patients 12 and older who weigh at least 40 kilograms, who have mild to moderate COVID-19 and are at high risk of severe COVID-19 outcomes, take Paxlovid orally twice daily for 5 days. Time is of the essence. It's important to start treatment as soon as possible, within 5 days of symptom onset for eligible people who test positive for SARS-CoV-2 infection, have mild to moderate illness, have one or more risk factors for progression to severe disease, do not require hospitalization due to severe or critical COVID-19 at the time of treatment initiation, do not have evidence of severe renal or hepatic impairment, and do not have a medication profile that precludes its use due to drug interactions. If you have patients who meet these criteria, consider prescribing Paxlovid. If your patients do not meet these criteria, I encourage you to consider other treatment options. Remdesivir is FDA approved and is also effective at reducing hospitalization and death. We have been hearing concerns about COVID rebound or recurrence of symptoms after a course of Paxlovid. Recurrence of symptoms 2 to 10 days or more after Paxlovid use has been reported in a small number of patients and has also been observed in patients who have not used Paxlovid. These patients generally have mild symptoms which resolve within a few days without need for hospitalization. To date, the recurrence of symptoms following the use of Paxlovid has not been associated with progression to severe COVID-19 or resistance to Paxlovid. And it's important to note that COVID rebound is not restricted to patients receiving Paxlovid. CDC recommends that healthcare providers continue to prescribe Paxlovid to their patients, especially their patients who are at increased risk of severe COVID-19 outcomes. With the strong scientific evidence that antivirals like Paxlovid reduce the risk of hospitalization and death, this continues to be one of our most important and effective tools to combat severe COVID-19 outcomes. I encourage you to talk with your patients about the benefits of taking Paxlovid and listen to their concerns. Thank you for providing dedicated, thoughtful, and compassionate care to our communities.